Thank you. Good evening, students. So today we will be discussing some MCQs from dental anatomy. I hope you can hear me. So let's start with the first MCQ. A 9-year-old patient presents with premature exfoliation of the mandibular second primary molar on the left side due to caries. A radiograph reveals a well-developed tooth bud in the same region. The dentist worries about potential space loss and future crowding. Which permanent tooth is most at risk of ectopic eruption or impaction in this region under these circumstances? So there is a premature exfoliation of the mandibular second molar, and there is a succedaneous tooth which is seen on the radiograph. So the question is, which tooth is most likely to show an ectopic eruption or impaction under these circumstances where the primary tooth has prematurely exfoliated? Right. So what would be the correct answer here? Options are mandibular second premolar, mandibular first premolar, mandibular canine, and mandibular first molar. So obviously, mandibular second premolar is the succedaneous tooth which would erupt in place of this second primary molar. Also, we know that when there is a premature loss of the tooth, there will be bone formation, and this tooth will now have to cut through this bone. So, first of all, its path is tedious, it's more difficult, and this would lead to its displacement, isn't it? So, mandibular second premolar is the correct answer. So, the next question. A 7-year-old child presents for a routine examination. 7-year-old, right? Which one of the following permanent teeth is most likely to have erupted or being erupting into the child's mouth at this age? So basically, which tooth erupts at the age of 7 years, right? Which permanent tooth would erupt at the age of 7 years? Options are maxillary lateral incisor, maxillary lateral, mandibular canine, mandibular central incisor, and maxillary canine. So which of these teeth do you think would erupt at the age of 7 years? So that's what the question is about. Is it maxillary lateral? Is it mandibular canine? Is it mandibular central incisor, or is it maxillary canine? So the question is simple, isn't it? So which tooth erupts at this age? It is the central incisor in the mandibular arch. Right? So the option A, yes, very good. Option A is the correct answer. Right? So mandibular central incisor erupts at the age of about 7 years. Whereas maxillary lateral incisor, it would erupt at an age of about 10 years, isn't it? 9 years or 10 years. And mandibular canine, again 9 to 11 years of age, right? Maxillary canine, this is the last anterior tooth to erupt, isn't it? This is the last anterior tooth to erupt. Just a minute. I think there is a problem with this file. The question has disappeared for some reason. Just a minute. extremely sorry. There seems to be some malfunction in this particular file, but yes, now it seems to be working. Yes, now it appears to be working. So the third question: a pediatric patient is brought in at 18 months of age, 1.5 years of age. You note that the child has both central and lateral primary incisors as well as a newly erupted first primary molar. So there are incisors and there is molar, first molar, right? Which of the following represents the usual sequence of eruption for the primary dentition? So we have to identify the correct sequence of the eruption of primary dentition. So which one do you think is the correct sequence? Is it central incisor, then first molar, then lateral incisor, canine, second molar, or is it central incisor, lateral, first molar, canine, and second molar, or is it lateral? Obviously, lateral incisor does not erupt first. So central incisor, lateral incisor, canines, first molar, second molar. So which of these do you think is the correct answer? So obviously, first the incisors will erupt, central incisor, lateral incisor, and then first molar followed by canine, and lastly the second molars will erupt. Right? So option B is the correct answer. Option B is the correct answer. Very good, everyone. So let's go to the next question. A pediatric dentist is preparing an access cavity on a primary second molar and warns the intern that the pulp horns in primary teeth often extend more coronally than expected. So pulp horns are more coronal in the primary as compared to the permanent teeth, right? Which of the following statements is most accurate about the pulp chamber of primary molars? So which is most accurate statement amongst all these? Option A, it is smaller than that of permanent molars, making endodontic treatment more complex. Option B, the pulp chamber in primary molars is typically more constricted at the CEJ than in permanent molars. So pulp chamber here is narrow, that is what the option B says, and pulp chamber is smaller than the permanent, that is what option A says. Option C says that pulp horns, especially the mesial ones, are proportionately higher and larger in primary molars than in permanent molars. So here what it says is that the pulp horns are higher and they are larger. And option D is root canal orifices of primary molars lie well below the cervical ridge, unlike permanent molars. So beneath the cervical ridge, obviously that will be too deep, whereas the pulp chambers of primaries, they are short, isn't it, as compared to the permanent. So obviously their coronal orifices, their canal orifices, they are higher as compared to the permanent. So obviously option D is incorrect. So which of these is correct? Option C, isn't it? Since the enamel and the dentine thickness is very less in primary as compared to the permanent, so the pulp chambers are relatively larger in primary as compared to the permanent, isn't it? The pulp chambers in the primary, they are relatively larger as compared to that of the permanent. Let's say this is the, obviously my drawing is very bad. Let's say this is the pulp chamber and the pulp canals. This is dentine, like this is dentine. And this here is the enamel, right? So in case of primaries, the pulp chamber is relatively higher, so as are the pulp horns. So pulp horns and pulp chambers, they are both relatively larger, and the pulp horns are a bit higher, especially the mesial pulp horn. So they are a bit higher. Why? Because the thickness of the dentine and the thickness of the enamel is less as compared to that in permanent dentition, right? So pulp horns are higher and the pulp chamber is larger. So option C is the correct answer. But the root canals, they are thin as compared to the permanent. So root canal is thin, pulp chamber is wide and it is larger. Question number 5. A newly extracted interior tooth from a child's mouth displays a crown that is relatively wider mesiodistally than cervico-incisally and has conspicuously bulbous cervical area, which feature best differentiates this tooth from its permanent counterpart. So there is a tooth which is wider mesiodistally as compared to its cervico-incisal length. So cervico-incisally it is shorter as compared to its mesiodistal width, right? And it has a bulbous cervical area, both labially, lingually, right? So which tooth are we talking about? Obviously, we are talking about the maxillary central incisor. This is the only anterior tooth where the mesiodistal dimension is greater than the cervico-incisal dimension, right? So, which feature best differentiates this tooth from its permanent counterpart? The presence of shovel-shaped lingual surface, the incisal ridge showing 3 distinct mamelons, a root that is stouter, that is thicker and approximately the same length as the crown, and a pronounced cervical ridge that is bulge on both the labial and lingual surfaces. So, if you look at this question, you would notice that the answer is within the question, isn't it? The answer is within the question. So, sometimes you will get such questions where the answer is within the question. So, if you read the question carefully, you will get the answer, right? The question itself says that the tooth is wider mesiodistally and then cervico-incisally and has a conspicuous bulbous cervical area. And same is the option here, the pronounced cervical ridge, a bulge on both the labial and the lingual surfaces. So, sometimes you will get such questions where the answer is within the question. So, do read the questions carefully, right? Sometimes the answer is within the question and it is abbreviated. So, sometimes you need to find out what those abbreviations mean, and maybe that will help you get to the answer, right? When describing the geometry of permanent posterior teeth, so permanent posterior teeth geometry from the occlusal perspective, some researchers note that maxillary premolars have a hexagonal or oval outline. So, it might have a hexagonal or an oval outline, right? Sort of hexagonal or oval outline. While mandibular premolars may appear more square or rhomboidal, which factor most influences these occlusal outline shapes? So, which is the factor that most influences these outline shapes, these occlusal outlines? So, options are position and size of the cusp ridges and marginal ridges, degree of enamel mineralization, direction of enamel rods at cervical line, and thickness of cementum at the root apex. So, which one do you think is the correct answer? Which one of these do you think influences the shape of the crown? Which of these do you think influences the shape of the crown from the occlusal side, from the occlusal perspective? So, this is the occlusal perspective. So, which of these do you think influences the shape of the crown? Is it the position of cusp ridge and marginal ridges? Is it the enamel mineralization? Is it the enamel rods, cervical line? Is it the cementum at the root apex? क्या आंसर होगा इसका? सिंपल है. इसमें से occlusal surface पे हमें क्या दिख रहा है? Occlusal surface पे हमें cusp ridges और marginal ridges ही दिखेंगे. Enamel mineralization does not have to do anything with the shape. Enamel rods, obviously, they again do not have much to do with occlusal outline because we are talking about them on cervical line, isn't it? Cementum again is present on the root, not on the occlusal surface. So, option A is the correct answer, isn't it? Option A is the correct answer. Very good. So, which of the following statements most accurately describes the contact area between posterior teeth? तो posterior teeth के अंदर जो contact area है उसके बारे में कौन सा statement एकदम सही बात कर रहा है? So, posterior contact areas are centered facial-lingually to maximize chewing force. So, okay, when we look at them from the occlusal view, The mesial contact is generally more cervical. Mesial contact is generally more cervical than the distal contact in posteriority. Contacts are always at the junction of occlusal and middle third of the crown. They are located more toward the buccal side of the crown, leaving large lingual embrasures. So obviously they are not centered, isn't it? In the posteriors, the contact are not centered facial-lingually, neither is it centered in the anteriors. So anteriors which are posterior, so they are never centered labiolingually or facial-lingually, right? The mesial contact is generally more cervical than the distal contact. Again, this is wrong because it is the distal contact which is more cervical. So distal contact is more cervical, isn't it? Distal contact, let's say this is the mesial contact and the distal contact would be more cervical, right? Option C, contacts are always at junction of occlusal and middle third of the crown. Again, this is false. As you can see, the mesial junctions, they are usually at the junction, whereas the distal junctions, they are in the middle third, right? And option D, what does it say? They are located more towards the buccal side of the crown, leaving a larger lingual embrasure. So if you take a careful look at this diagram, what you would notice is that it has a larger lingual embrasure as compared to the buccal embrasure, isn't it? It has a larger lingual embrasure. So what it means is that these proximal contacts, they are more buccally located, isn't it? They are more buccally located. So option D is the correct answer. Is it clear? Feel the dentistry, right? Option D is the correct answer, isn't it? So contacts are never always at the junction. So this statement is like for all the teeth, it is always at the junction, be it mesial contact, be it distal contact, but that is not true, isn't it? On the mesial side, yes, it is at the junction, but on the distal side, it is at the middle third, right? When comparing the facial and lingual heights of contour, so what are facial and lingual heights of contour? Let's say this is the tooth that we observe from proximal view. Now, this is the site of maximum convexity, isn't it? If you take a look at this tooth, this is the site of maximum convexity. Similarly, here I could not make it very clear, so let me make it a bit more clear. Right, so here again, this is the site of maximum convexity. So basically, height of contour is the site of maximum convexity at that particular surface. So maybe this is the labial surface, this is the lingual surface. So what they are talking about is when comparing the facial and lingual height of contour in the mandibular first molar, which statement is correct? Option is both facial and lingual crests of curvature are at the same vertical level. So they are not at the same vertical levels. One is a bit higher and the other one is a bit more cervical. So option A is incorrect. So which of these two do you think is more occlusal and which is more cervical? The facial crest of curvature is in the cervical third, whereas the lingual crest is often in the middle third. The lingual crest of curvature is closer to CEJ than the buccal crest. So according to option C, the lingual crest is lower as compared to the labial crest. No, there is no alarm blinking here. यहाँ कोई alarm नहीं है. The lingual crest of curvature is closer to the CEJ than the buccal crest. So what it means is it is lower, right? And option D says that there is no visible contour difference once the tooth is fully erupted. So again, this is incorrect because eruption does not mean that there would be an adhesion or loss of surface of the tooth. So option D again is incorrect. So of the B and C, C definitely appears incorrect because the lingual curvature is not more cervical, it is rather more occlusal, as you can see in this diagram. The labial crest of contour is more towards the cervical, and when you compare it with the lingual crest of curvature, it is more occlusal, isn't it? So option B, that is the lingual crest of curvature, is in the middle third, whereas the labial crest of curvature is in the cervical third. This is the correct answer. Now, if you compare it to the maxillary teeth, what you would notice is the maxillary teeth, they appear trapezoidal, isn't it? The maxillary teeth, they appear almost trapezoidal. The maxillary teeth, they appear almost trapezoidal. So in the maxillary teeth, though the lingual crest of curvature is slightly higher, but they are both in the cervical third, right? They are both in the cervical third. In the mandibular posteriors, since the teeth are slightly lingually tilted, isn't it? The teeth are slightly lingually tilted. So lingual crest of curvature is higher as compared to the labial side. And the tooth, its outline appears almost rhomboid. The outline of the tooth appears almost rhomboid, whereas here it appears almost trapezoid. Right? A 19-year-old patient complains of a small peg-shaped tooth. So there is a peg-shaped tooth in the maxillary anterior region, which they find unaesthetic. Radiographic examination shows a normal shaped root but a conical crown. So crown is conical but the root is normally shaped. Which of the following teeth is most likely affected? So which tooth is most likely affected by this condition? That is peg-shaped tooth. So maxillary central incisor, mandibular central, maxillary lateral and mandibular lateral. So which of these do you think is the correct answer? So obviously we can rule out the mandibular ones because the question itself says the tooth is maxillary, isn't it? So amongst A and C, which is the correct answer? Now obviously we often call this peg-shaped tooth as peg-shaped lateral or peg lateral because the laterals are most commonly affected or most frequently affected by this condition, isn't it? So basically, most variable anatomy. So the most variable anatomy of the tooth, it would be third molars followed by upper lateral, isn't it? Followed by upper lateral. So upper lateral also has a very much variable crown morphology or the crown anatomy. So option C is the correct answer. Is it clear? A 35-year-old patient exhibits significant incisal wear on the mandibular incisors. On examination, you note the difference in incisal edge thickness and inclination relative to the maxillary incisors. Which statement most accurately differentiates permanent mandibular incisors from their maxillary counterparts? So we have to differentiate the mandibular incisor from the maxillary incisors, and it is given in the question that there is a incisal wear, right? So mandibular incisors have more pronounced lingual pits than maxillary incisors. So obviously this is wrong. Maxillary incisors, they have lingual concavity, whereas mandibular incisors, their lingual surface is almost smooth, isn't it? Mandibular incisors, they have almost smooth lingual surface. The cingulum on the mandibular incisor is more prominent than on maxillary incisors. This again is incorrect, because cingulum is more prominent on maxillary incisors, that too in the maxillary lateral. So the most prominent incisor cingulum is in the upper lateral. So upper lateral is the most prominent incisal cingulum. So amongst all the incisors, the upper lateral incisor has most prominent cingulum. Mandibular incisal edge slopes labially. So what it means is, let's say this is the mandibular incisor before incisal wear. After the incisal wear, this is how it would appear. So the incisal edge, it slopes labially. The incisal edge slopes labially. Mandibular incisor often have a cusp tip and a greater labiolingual dimension. So obviously, how can they have a cusp tip? These are incisors, they are incisal edges. So again, option D is incorrect. Yes, option C is the correct answer. And as you may notice here, that after the incisal wear, the lingual surface appears to be longer as compared to the labial surface because of the direction of incisal wear. As compared to, now compare this to the incisal wear of maxillary incisors. Compare this to the incisal wear of maxillary incisors. So maxillary incisors, they will show the incisal wear in the lingual side, isn't it? They will show an incisal wear on the lingual side. So their lingual surface would appear relatively shorter as compared to the labial surface once incisal wear has taken place. Is it clear? Now why does this happen? Because in the normal occlusal relationship, the mandibular incisors are on the lingual side of the maxillary incisors. So obviously, more of labial surface would be lost on the mandibular incisors and more of lingual surface would be lost on the maxillary incisors or all the maxillary anteriors, be it canine or incisors. Is it clear, Bhavna? And everyone else? Compared to the maxillary canine, the crown of the permanent mandibular canine typically has which of the following distinguishing traits? So compared to the maxillary canine, Ajay, can you tell me which of the angles classification of occlusion is most common? We have seen that there is angles class 1, class 2, class 3. Amongst the class 2, we also have class 2 division 1, division 2, right? So can you tell me which of these three is the most common or is most frequently seen? Is it class 1, is it class 2 or is it class 3? Which is most frequently seen? So compared to the maxillary canine, the crown of the permanent mandibular canine typically has which are the following distinguishing traits? So options are a more prominent cingulum and more pronounced marginal ridges. So do you think mandibular canine has more prominent cingulum as compared to the maxillary canine? And the answer is no. Isn't it? Very good, Bhavna. It is class 1. That's why it is class 1. Right? Yes, very good, Komal. So always remember that this classification or this nomenclature A, B, C, D, 1, 2, 3, 4. So why do we call a particular feature as class 1 or a particular feature as type A or type B or type C or type D? Because if it is like a conducting like a nerve or some other thing like blood vessels, right? So something that is positive for you, right? Let's say nerve conduction. So the one that is conducting at the rapid speed, most rapid speed, that would be classified as A, and the one that is conducting at the least speed would be classified as B, and the lower speed yet would be classified as C. In the diseases, the one that appears most commonly would be classified as type A or class 1, something like that, and the one that appears less frequently would be classified as B, yet lesser frequently would be C or D, right? So based on this classification, you can get some idea about their frequency. So option B, mesodistal width significantly larger than labiolingual width. So mesodistal width is significantly larger than labiolingual width. So when you look at it from the incisal view, it would appear broader mesodistally. Option C, a cusp tip point positioned lingual to the root's long axis from the proximal view. So when you look at it from the proximal side, you would notice that the incisal edge is, or the cusp tip is lingual to the bisector, and a crown that appears longer and narrower. So which of these do you think is a distinguishing trait? Now here we have two features that are correct. Here we have two options that are correct. First is option D, that is the crown that appears longer and narrower. We know that the mandibular canine, it has a length of approximately 11 millimeters, and the maximum crown length in the entire dentition is of mandibular canine, isn't it? And obviously it appears narrower when we compare it to the maxillary canine. The maxillary canine appears broader. isn't it? So this is correct. And a cusp position lingual to the root's long axis from a proximal view. So when you look at it from the proximal view, you would notice that yes, the crown or the incisal edge is indeed positioned lingual to the bisector line, isn't it? The cusp is indeed positioned lingual to the bisector line. So both options C and D are correct. But which of these two do you think is more prominent, is better amongst these two? Which is better amongst these two? Is it option C or option D? Which is better? Which of these two do you think is better? Because obviously we can't mark both of these options, isn't it? One of these has to be better than the other. And option D is a unique feature, isn't it? It has the longest crown of all the teeth, isn't it? It has the longest crown of all the teeth, and that's why this is more specific. Is it clear? So though option C and D are both correct, yet we will go with D because that is more specific. It is more unique. Right? This is a unique feature. Because mandibular canine has the longest crown. Right? From an incisal or you can say occlusal perspective, which feature helps differentiate a permanent mandibular canine from a maxillary canine? So from an incisal view, right? A more convex labial outline and a distal-lingual twist of the crown. A nearly symmetrical outline with no mesodistal taper. So we can rule this out because the canines do not appear symmetrical, right? Or for that matter, there is only one tooth that appears symmetrical, and that is the mandibular central incisor. So mandibular central incisor is the tooth that appears symmetrical. A prominent lingual ridge creating two equal lingual foci. This again is incorrect, right? Because the mesial ridge, as you know, the mesial ridge is small, and since the mesial ridge is small, the mesial fossa is also smaller as compared to the distal fossa. So these fossa, they are not of equal dimensions. A cusp that lies far mesial to the midline of the root. So this again is not a differentiating feature, right? Because the mesial cusp is smaller in both mandibular and maxillary canines. So cusp would appear slightly mesially displaced in both of these teeth. So option A, that is the mandibular canine, appears a bit more convex, right? Labially. That is the correct answer. So the crown appears a bit distally twisted and has a more convex or more accentuated labial surface. Is it clear? So option A is the correct answer here, right? Is it clear? Do you have any doubts? If you have any doubts, you can ask, right? You can stop me and you can ask your doubts. So our dentist notes a distinctive groove crossing a mesial marginal ridge. So there is a groove which crosses the mesial marginal ridge of a newly erupted maxillary premolar. So there is a maxillary premolar and its mesial marginal ridge shows a groove. Radiographic examination shows a bifurcated root. Which tooth is most likely being observed? So which tooth do you think is being talked about in this question? So there is a maxillary premolar and its mesial marginal ridge is marked by a groove and it has a bifurcated root. So do you really need options to answer this question? Now obviously we can rule out the mandibular teeth because we are talking about maxilla. So it is the maxillary first premolar. So maxillary first premolar is the only premolar. It is the only premolar to have two roots, isn't it? It is the only premolar to have two roots. So all these other three premolars, these are single rooted teeth, isn't it? These are all single rooted. So only maxillary first premolar is double rooted or it has bifurcated roots. So let's go to the next question. When comparing the two cusp mandibular second premolar So two cusp mandibular second premolar with the mandibular first premolar. Which of the following is true regarding the lingual cusp? So we need to talk about the lingual cusp of the mandibular second premolar, right? And we have to compare it with the mandibular first premolar. So lingual cusp of mandibular second premolar compared to the lingual cusp of mandibular first premolar. So obviously it is a bit higher than this. So options are, it is smaller than that of the mandibular first premolar. So obviously this is incorrect. It is larger, isn't it? It is more developed and taller than that of the mandibular first premolar. And yes, this does appear correct. It is equal in height to the buccal cusp. This also is correct. It consists of two distinct lingual cusps separated by a root. And this again is incorrect because we are talking about two cusped mandibular second premolar, not three cusps. Had it been three cusps, then we would have marked it as correct. But this is only two cusps. So option D and A are incorrect. But option B and C, they appear to be correct. So which of these two do you think is the correct answer? So which of these two options would you choose? Which of these two options would you choose? Option B or C? B not C? इसका क्या मतलब हुआ? B को चूज नहीं करेंगे, C को चूज करेंगे, या C B को चूज करेंगे, C को नहीं करेंगे? B के बाद कॉमा है या नॉट के बाद कॉमा है? मुझे ऐसा लगता है भावना कह रही है B को चूज करेंगे. It is more developed and taller than that of the mandibular first premolar. Very good. तो भावना B क्यों चूज किया हमने? और तुम्हारा आंसर बिल्कुल सही है, क्योंकि क्वेश्चन पूछ रहा है we have to compare lingual cusps of both the teeth, isn't it? We have to compare the lingual cusps of both the teeth. We do not have to compare the lingual cusp with the buccal cusp in the same tooth, right? So though option C is correct, it is irrelevant to this question, right? Option C, it is correct, the statement is correct, but it is irrelevant to this question. So option C को हम wrong mark करेंगे और option B को हम correct mark करेंगे, right? तो भावना बिल्कुल सही कह रही है. Very good भावना, है ना? We have to read the question carefully. So though option C is correct, it is irrelevant to the question. Next, a 35-year-old patient is in for restorative treatment on her maxillary first molar. So maxillary first molar का restoration के लिए आई है. During clinical examination, the dentist notices a small tubercle on the mesiolingual cusp that shows a developmental groove. So there is a small tubercle on the mesiolingual cusp. So there is the mesiolingual cusp and there is a small tubercle on it, right? And there is a developmental groove separating it from the main cusp. So this tubercle is known as. So what do you think would be the name of this tubercle? Is it the cusp of Carabelli? Is it dens vaginatus? Is it cingulum rest, or is it distal lingual tubercle? Yes, option A is correct, isn't it? Cusp of Carabelli is also described as a, or you can say it is classified as a tubercle, isn't it? Cusp of Carabelli or dens vaginatus, they are both classified as a tubercle. Clear? So even Talon's cusp is classified as a tubercle. So be it cusp of Carabelli, be it dens vaginatus, be it Talon's cusp, they are all classified as tubercles. So next question, a 30-year-old patient has a newly restored mandibular first molar. So mandibular first molar is newly restored. The dentist notes that the occlusal groove pattern includes a prominent mesiobuccal groove and a distobuccal groove branching from the central pit area. This arrangement typically, so we have to complete this statement, right? It results in three major buccal cusps. So if we have a mesiobuccal groove and a distobuccal groove, then obviously it is a three cusp arrangement. It indicates about a three cusp arrangement. So yes, option A appears to be correct. it yields a plus or a cross-shaped groove pattern. So plus or cross-shaped groove pattern is seen in Mandibular's second molar, which has only two buccal and two lingual cusps. So option B can be ruled out. Option C is known for a pronounced oblique ridge. This is seen in maxilla, so again it can be ruled out. Option D is consistent with 5 functional cusps including a distal cusp. So this again is correct. So option A and option D, they both appear to be correct. So why should we rule out option A, Pankti? Why did you rule out option A, or how did you rule out option A? How did you rule out option A? Because it says 3 major cusps. So the catchword here is major, isn't it? We do have 4 buccal cusps, sorry, we do have 3 buccal cusps, but only 2 are major cusps. The distal cusp, right? This distal cusp, is a secondary cusp, isn't it? Distal cusp is the secondary cusp. It is not a major cusp. So rest all are primary. So rest all the 4 cusps are primary, but the distal cusp is a secondary cusp. Very good पंक्ति, ठीक है ना? तो इस तरीके से अगर आप सोचोगे तो आपको आसान होगा रूल आउट करना, right? It would be easier for you to rule out. So option D is the correct answer, right? And similarly, in the maxillary first molar, which is the secondary cusp, here. This is the oblique ridge. So this is the oblique ridge, right? Mesiopalatal cusp, distopalatal cusp, mesiobuccal cusp, and distobuccal cusp. So which cusp here is the secondary cusp in the maxillary first molar? Maxillary first molar is derived from tritubercular tooth, isn't it? Mandibular is derived from quadritubercular, and maxillary is derived from tritubercular. So it is the distopalatal cusp that is the secondary cusp here, isn't it? So next question, regarding pulp horns in a newly erupted permanent maxillary central incisor. So it is the permanent maxillary central incisor. Which is true? Options are, there is usually only one pulp horn centered beneath the cingulum. There is typically 3 pulp horns corresponding to 3 facial lobes. The pulp chamber is completely calcified at eruption. Obviously, option C is incorrect. Pulp horns never extend under the incisal edge. This again is incorrect. So we have to find the correct answer amongst option A and B. So there is usually only one pulp horn centered beneath the cingulum, and there are typically 3 pulp horns corresponding to 3 facial lobes. So which of these is correct? So this is how the pulp chamber of the newly erupted maxillary central incisor, or for that matter any incisor, appears. There are 3 pulp horns, isn't it? There are 3 pulp horns, and they correspond to the 3 mamelons. So they are found beneath the mamelons, right? So option B is the correct answer. But with age, as the second dentin deposition takes place, we will notice that these pulp horns, they are no longer visible after some time, right? So pulp horns, these are commonly visible only in the newly erupted tooth. In a normal occlusal scheme, the primary role of the functional cusp of posterior teeth is to. So what is the function of the functional cusp in the posterior teeth? So obviously functional cusps are seen in the posteriors. There are no functional cusps in the anteriors, right? Maintain vertical dimension and contact in centric occlusion. Guide the mandible during the lateral movements. Disocclude anterior teeth during protrusive movements and protect the incisal edges of anterior teeth. So which of these do you think is the correct answer? let's say this is the maxillary molar and this is the mandibular molar, isn't it? And these are the functional cusps. So what do you think is the role of functional cusp? Upper palatal and lower buccal. They form the centric stop, isn't it? They form the centric stop, and that is why they are also called the holding cusps. So what they do is they maintain the vertical dimension and they contact in the centric occlusion. So option A is the correct answer. Guide the mandible during lateral movement. That is the job of guiding cusp, isn't it? This is the job of guiding cusp. So option B is the job of guiding cusp, and that's why they are called guiding, because they guide the mandible during their lateral movement. Disoccluding the anterior teeth during protrusive movement. So that is not done by the posteriors. When the mandible moves posteriorly, it is the incisal edge that comes into contact of the upper and lower incisors, and that's how the posteriors get disoccluded, isn't it? And protect the incisal edges of the anterior teeth. This again is incorrect. So option A is the correct answer, right? Which of the following best describes the concept of canine guidance in an ideal occlusal scheme? So what is canine guidance? So basically what happens is, let's say this is the canine and then these are the premolars, then molars. So when the jaw moves laterally, isn't it? When the mandible moves laterally, what will happen? Some of the teeth will touch, right? Some of the teeth will make the occlusal contacts while others will disocclude. So if only the canines occlude and all the posteriors are disoccluded, then it is known as canine guidance, isn't it? So premolars provide disocclusion of the anterior teeth in the lateral movement. So this is incorrect because it is canine guidance, not the premolar guidance. Canines guide the posterior tooth into stable central occlusion. Again, it is incorrect because the canine guidance comes into play in lateral movement, not in when the jaw moves back into centric occlusion, right? The canines disocclude the posterior teeth during the lateral occlusive movement. So as we just explained, canine they occlude, but all the posteriors they will disocclude, and that's how the mandible moves into a lateral position. So canine guidance is only the canines are occluding. Rest all the posteriors they are disoccluded. But in group function, all the teeth right from canine to the molars they are in contact, right? So there is canine guidance and then there is group function, isn't it? So what's the difference between canine guidance and group function? So what is the difference between canine guidance and group function? In case of canine guidance, only the canines are in contact, right? Only the canines are in contact. Rest all the teeth, premolars, molars, they are all out of occlusion, isn't it? Whereas in case of group function, all the teeth from canine to premolars to molars, they are all in contact, right? So which of these two do you think would be seen in younger individuals and which would be seen in older individuals? So obviously the newly erupted teeth, they are all sharp, isn't it? They have the proper cusp tip. So canines would have a prominent cusp tip in young individuals, whereas over the time they would show wear and tear, they would show attrition, isn't it? So once the cusp tip of canine undergoes attrition, then there would be a change of canine guidance into group function. So group function is seen in older individuals, isn't it? Yes, very good, Pankti. Canine guidance is seen in younger and group function is seen in older individuals. So next question, the anteroposterior occlusal curvature that begins at the tip of the lower canine and follows the buccal cusp tip of the mandibular posterior teeth and continues on to the condyle. तो वो हमने यहाँ नहीं लिखा है, but that is understood, isn't it? It starts from the canine goes through the buccal cuspids of all the posteriors and then ends at the condyle. So which occlusal curvature are we talking about? Is it curve of Wilson? Is it curve of Monsoon? Is it Bonwell's triangle, or is it curve of Spee? So the correct answer here is curve of Spee, isn't it? So right from the canine to the premolars to the molars and then continuing backwards to the condyle, right? So we are talking about curve of Spee, isn't it? Curve of Spee. So Bonwell's triangle, I think you must have read in your prostho, right? So what is Bonwell's triangle? Bonwell's triangle, basically from the midpoint or from the mesial contact of lower anteriors, we make a triangle, and at one end of this triangle is the left condyle, at the other end is the right condyle, right? Condyles and lower anteriors, lower central incisor, the midpoint of the lower central incisors and the condyles on the either side. So basically this forms an equilateral triangle. So there is an equilateral triangle with the sides of almost 4 inches, isn't it? 4 inches. Basically when it was first studied, it helped to differentiate between the female and male, because in females this Bonwell's triangle is a bit smaller as compared to the males, right? So basically its use is in prosthodontics. Yes, very good, Pankti. So next question. In an ideal intercuspal position, which statement best reflects the typical occlusal contact on posterior teeth? So in ideal intercuspal position, that is in class 1 angles, class 1 occlusion. Functional cusps oppose ridges on the opposing arch. So they oppose ridges on the opposing arch. Non-functional cusps support the vertical dimension of occlusion. So when they are non-functional, that is when they are guiding cusp, how would they support the dimension of occlusion? It is the job of the functional cusp or the working cusp, isn't it? The lingual cusp of mandibular molars, they are again non-functional or the guiding cusps. Articulate with opposing marginal ridges. Now the guiding cusps, they oppose the grooves or embrasures, and the supporting cusps, they will occlude with the central fossa or marginal ridges, right? So here we are talking about the lingual cusp, that is non-functional cusp, or the guiding cusp. So the guiding cusp cannot occlude with the marginal ridge. So again option C is incorrect, right? Option D, each tooth contacts its antagonist on only one opposing tooth. So again this is incorrect, because every tooth has a contact with 2 opposing teeth, isn't it? We have studied in the class, we have made this picket fence diagram, isn't it? We have made this picket fence diagram where each tooth has a contact with at least 2 opposing teeth, isn't it? So here we can see that it is contacting with 2 opposing teeth. Again, there is contact with 2 opposing teeth. The only exception or the only teeth which have contact with a single antagonist, right? So the only teeth with contact with single antagonist, they are lower 1 and upper 8, right? They are lower 1 and upper 8. These are the only teeth which have single antagonist, isn't it? So the correct answer here would be a functional cusp opposes or contacts the central fossa or the marginal ridge of the opposing arch. So here we can see that it opposes ridge on the opposing arch. Is it clear? Option A is correct. Is there any doubt? So let's go to the next question, this is the last question, question number 22. A 32-year-old patient's radiograph shows significantly reduced pulp chamber height. So the pulp chamber height is reduced. So maybe initially the pulp chamber was large, but gradually the pulp chamber, its height was reduced in a permanent mandibular first molar. So this is the permanent mandibular first molar. Despite no apparent caries or restorations. So there are no caries, there is no restoration. This finding is most likely due to options: congenital absence of normal dentin tubules. So had there been a congenital absence of normal dentin tubules, the dentin would be entirely solid. There would be no caries attack, no nothing, isn't it? And there would be no odontoblast. So had there been no odontoblast, there would be no deposition of the dentin. So obviously option A is incorrect. External cervical resorption of the root. So had there been a resorption of the root, dead tract or a sclerotic dentin would be seen, and the deposition of dentin would have taken place in the root, not in the crown. So option B is again incorrect. A shorter than average clinical crown from eruption delay. Again this is incorrect, because the size of the pulp chamber has reduced after eruption, isn't it? And option D, continuous secondary dentin deposition over time. So this is the correct answer. So where does the maximum secondary dentin deposition takes place? It is on the floor of the pulp chamber, followed by the roof of the pulp chamber, followed by walls of the pulp chamber. So the secondary dentin deposition is maximum on the floor, followed by roof, followed by the walls, labial, lingual, buccal, labial, lingual, mesial and distal. Is it clear? So maximum deposition of secondary dentin is on the floor of the pulp chamber. So these were all the MCQs. Do you have any doubt? Do you have any doubt, any question that you want to ask? Genes involved in tooth development. We already explained, we have studied it yesterday also. Chalo, I'll tell you once again. So there are some genes that we need to remember, right? We don't need to remember all the genes, because there are more than 100 genes that are participating in tooth development. So these are those genes that we have discovered, these 100 genes. But there are many more that we haven't yet studied, right? So of these genes that we need to remember are FGF8, WNT, SHH. All of these are proliferative, and they are all expressed in the epithelium. There is only a single inhibitory gene, that is BMP2 and 4. These are inhibitory and they are expressed in connective tissue, or you can say ectomesenchyme. Clear? Sides of the Bonwell's triangle deadly, but it is an equilateral triangle, and its 3 points or apex, they are at the mesial contact of the central incisors, mandible central incisors, and the condyles, left and right condyles. So these are the points of this triangle, right? And its side is approximately 4 inches. No, it is from here to the mandibular triangle. It is not a curve, it is a triangle, right? It is not a curvature. It is not a curvature like this. This is the incisor. These are the condyles. So it is not a curved triangle. It is a straight. It has a straight boundary, right? It is a straight boundary. So it does not touch any other tooth except the mandibular central incisor and the condyles on either side. Right? So these are some of the genes that have proliferative and inhibitory action. Now, which are the genes that are expressed initially? So initially in the epithelium. So let's say this is the epithelium, and then beneath it is the connective tissue. So initially the genes that are expressed are PITX2 and FGF8. So in response to these, LHX6 and 7 and PAX9, these genes will be expressed in the ectomesenchyme. Now, what are the roles of these different genes? So you need to remember first of all FGF8. So FGF8, it establishes the oral aboral axis. So what do you mean by oral aboral axis? Basically the alignment of the tooth. So oral aboral axis. So crown part should erupt into the oral cavity and root should remain in the alveolar bone. So this is the oral aboral axis, isn't it? So at the crown part FGF8 is expressed and the root part LHX6, 7 is expressed, right? So what is the role of the PAX9? So apart from establishing the oral aboral axis, FGF8 also stimulates the expression of PAX9 gene. So PAX9, what is the role of PAX9? Its role is in patterning, right? Its role is in patterning. Now what is patterning? Patterning is the formation of specific tooth at specific location. So incisors must form in the anterior region, molars must form in the posterior region. That is patterning, isn't it? So what is patterning? Formation of specific tooth at specific location. So formation of specific tooth at specific location. Now let's say this is the dental arch, right? This is the dental arch. So PAX9 is expressed everywhere on the dental arch, isn't it? It is expressed everywhere on the dental arch. But let's say these are the dentate regions. Wherever you see the tooth, that is the dentate region. So in the dentate region, FGF8 is expressed, and in the interdental region, BMP is expressed. So what does BMP do? BMP 2 and 4, they are inhibitory. As I told you, they are inhibitory. So they inhibit PAX9. So BMPs are expressed in the interdental region, whereas in the dentate area, FGF8 is expressed. So what will happen if there is an overexpression of FGF8? There will be supernumerary teeth. And what will happen if there is an overexpression of BMP 2 and 4? There will be hypodontia or oligodontia or anodontia in severe cases. So if BMP increases, there will be anodontia or hypodontia or oligodontia. If FGF8 increases, there will be supernumerary tooth. उल्टा हो जाए तो FGF8 कम हो जाए, FGF8 कम हो जाए या FGF8 या BMP 2 and 4 दोनों ही कम हो जाए, तब क्या होगा? एकदम उल्टा हो जाएगा, राइट? FGF8 कम होगा तो there will be hypodontia and BMP कम होगा तो there will be supernumerary teeth, right? Is this clear? So WNT and SHH and FGF8 collectively they have a role in initiating the dental lamina or differentiation of dental lamina from the primary epithelial band. So they also act on primary epithelial band to form dental lamina. So that is also the role of WNT, SHH and FGF8. Is it clear? क्या आप सबको समझ में आ रहा है? और जब एक बार बड बन जाता है, राइट, लेट्स से दिस इज द बड, फ्रॉम बड टू cap stage, right? This transition also involves the participation of PAX9 and MSX1 gene. So in the absence of either of these genes, tooth formation would be suspended at bud stage. In the absence of FGF8, tooth formation would be suspended at dental lamina stage. Is it clear? क्या सबको समझ में आ रहा है? पैक्स 9, MSX1, FGF8, SHH, WNT ये सब समझ में आया? कुछ proliferative है, कुछ inhibitory है. Inhibitory केवल एक ही है, BMP2 and 4. So these two are inhibitory. Proliferative बाकी सब है, WNT, SHH, FGF8, PAX 9. These are all proliferative, right? Then there are certain genes which are responsible for the morphology of individual teeth. So ALX3 is responsible for incisors, right? ALX3. Then there is MSX1 and 2, which is expressed in anterior region. So along with MSX1 and 2, DLX1 is expressed in canine region, right? It is also expressed in canine region. DLX1 and 2, these are for the posterior region, right? These are for the posterior region. But MSX2 also overlaps in premolar region, and BARX1 is specific for molars, right? So BARX1 is specific for molars, ALX3 is specific for incisors, MSX and DLX. Though MSX is specific for anteriors and DLX for posteriors, but they overlap in the canine premolar region. Is it clear? So these are some of the genes that you need to remember, right? Quite doubt? Is there any other question that you want to ask? Is there any other question that you would like to ask? आकांक्षा, आप सबको समझ में आया? कोई और सवाल पूछना है बच्चों? Is there any other question that you want to ask? अगर कोई और सवाल नहीं है तो फिर हम क्लास को ओवर करते हैं, ठीक है? चलो, टेक केयर, ऑल द बेस्ट. I don't get your query. Kindly seen in chat section. I think I have already answered your query about the question number 18, right? The Bonville triangle, it does not pass through the cusps of the posteriors. It just touches 3 points, both the condyles and the mesial contact point of the mandibular central incisors, right? So it does not pass through all the posterior cusps, and that's why it is not the correct answer. Is there anything else? Dental bud, did you get your answer? The Bonville triangle, it does not touch all the cusps. It just touches the condyles and the mandibular incisal edge. That too, the mesial contact of the mandibular central incisors, right? It is not a curve like this. So let's say that these are the mandibular centers and these are the condyles. So like curve of speed does not show a curvature. It is a straight. Its boundary is drawn as straight. DL1 only in posterior region. भाई क्या बोल रहे हो डेंटल बट समझ ही नहीं आ रहा है मुझे. इसका क्या मतलब है DL1 only in posterior region? Is there anything else you want to ask? तो प्यूपिडेंटल बट ने आखिर में यस सर कह दिया है, तो हम इसे साइन ले लेते हैं कि DLX, देयर इज नो DL1 जीन, इट्स DLX 1 and 2, इसलिए मुझे समझ नहीं आया. Yes, DLX1 is in posterior region, DLX1 and 2 they are both posterior specific. D is for distal, M is for mesial. So DLX1 and 2 are posterior specific, though they overlap in the canine region. So DLX1 overlaps in the canine region, right? Chalo then, good night.